Now, now the sound is missing again. Okay, how do you do this?
Hello, can you try to speak again?
Okay, now I can hear you, Dr. Kanu. Do you hear me?
Yeah, I can hear you. Probably there's some problem with the headphones. I cannot
Mm-hmm.
hear you while using that.
Oh, okay.
But can you hear? Is that
Yes,
okay?
yes, we can hear you now, clearly now.
Okay.
Yeah.
Okay. Good morning, everybody. I'm sorry. I mean, I was waiting for some time, and then I'm not sure what happened to the. I cannot hear it with the headphones,
Mm-hmm.
but I hope you can all hear me.
Yes, we can hear you now.
Is it okay? Is it clear?
It's clear. Yeah,
Okay.
I've already made an introduction about you. So
I
I was giving the floor to you. So
I see.
I think you can already start with your talk, please.
Okay,
Thank
great.
you.
So we have a lot of participants here today, and I'm very happy that I have got this chance to interact with all of you. And I'm really looking forward to having some, not just a talk, but some kind of interaction. So I would like to share my screen and start with the presentation. Please do let me know if you can see it.
Yes, we can see it.
Great. So I will just put it into the slideshow. Okay, that's how it works. So I'm very happy that I've been invited here to share with all of you about the psychosocial impacts of COVID-19 on the well-being of young adults. And what I'm going to be doing today is just sharing some applied behavioral science perspectives. So just a little bit about why am I doing this? So I am Kanu Priya. You can call me Dr. Kanu, and I've been working at this university in Bangkok, Thailand. So I've been working at the Behavioral Science Research Institute for over 10 years. And this is the place I did my PhD also from. So as you can see, it's behavioral science research. So they are like behavioral science and research. So it's a combination of what we do out here and why it is applied. So they are like perspectives that what we want to do is we want to study behavior from an interdisciplinary perspective. So psychology is very important in this because it's human behavior. And whatever we study, we also want to apply that knowledge to improve the quality of life of people. So this is something I think over a period of time, I find it fascinating that, we are not just creating knowledge, but we are also applying that knowledge to help improve the quality of life. So that's about me. If you have any questions about me, you can ask later. So what I'm going to be sharing today is something about the background of the pandemic and the well-being and some theoretical perspectives. Then I'm going to be talking a bit about my research that I have been conducting during this time, and will be sharing some thoughts about the implications of these research. So I would just like to start with just giving an overview. I think all of us know that pandemic has been unexpectedly and shockingly, it has changed our lives in unprecedented ways since March this year. And well-being has been impacted in several dimensions. So not just physical well-being, of course, was the main thing, but mental health, social well-being, spiritual well-being, and overall the concept of well-being is changing. So we perhaps have a new normal concept of well-being as we are going along in this COVID-19 situation. So several researches were initiated across various countries, and I'm sure Indonesia has been doing some very good work as well. So my research actually was initiated in April this year. As I was sitting down in the lockdown at home, I thought it's like, as a researcher, it's very important for me to find out what exactly is happening across the world. And not just world, but for me, it started like I am an Indian. So living in Thailand, so it was very important for me to find out like what is happening in Thailand and what is happening in India. I was so concerned, not just personally, but also as a researcher. And is there something different that people are experiencing? So that research question led me to develop this research. And my research was initiated in April. So then I prepared the proposal, prepared the survey, and it was focusing on the coping and well-being of people living under COVID-19 lockdowns and restrictions. So the significance, or what I hope would be meaningful, is that I would have some understanding about the psychosocial factors that impact well-being, and especially to find out something more about what are the vulnerable groups, what are the groups at risk during this time. And finally, because I told you it's like applied behavioral science, so for me this research is not just important in creating or documenting knowledge, but also trying to find some applications like developing interventions. So the key theoretical concepts of my talk today is about behavioral science perspectives, well-being, and the psychosocial factors specific to the COVID-19 pandemic. So what is a behavioral, why a behavioral science perspective is important? So what is the significance of this? So I would just like to share with my audience. I cannot see you, but I would like you to have this kind of an understanding that a behavioral science perspective, specifically to what the kind of work that we are doing at our institute, it helps us to develop a holistic and a systematic understanding of behavior through an interdisciplinary approach. So interdisciplinary approach is that we don't just see a problem or an issue from one discipline, but from different disciplines. For example, I think in a COVID situation, psychology is very important, but we can't just see a person from a psychological lens, but we need to understand the cultural, the social, and the other dynamics that are coming into play. So another thing is about applying knowledge. So any knowledge that we create is important because we can do something to change the conditions around us. So why this behavioral science perspective during COVID? So there is not just from my experience, but there is like documented research evidence talking about a behavioral science perspective. For example, Bevel et al. This year they have done a research about the COVID-19 impact, and they said that this is as early as in April or May. So they said about pandemic requires a large scale behavior change. This significant psychological burdens on the individuals need to be accounted for. And what social and behavioral sciences can do is they can help us to align the human behavior with the recommendations of the epidemiologists and public health experts. So the first aspect was about the change in behavior, how social and behavioral scientists could work together so that people can do the right thing. For example, just wear a mask or maintain that physical distancing. So how can we understand that people can change? As behavioral scientists, we need to understand that aspect. Another research by Saladino and al., this is published in October, and this talks about the psychological well-being of the most vulnerable groups, including children, college students, mental health workers, frontline health workers, and so on. And they have already documented that more people are likely to develop post-traumatic stress disorders, anxiety, depression, and other symptoms of distress. So there are two aspects. One was about the behavioral change, and the second is about the impact that this COVID is having. So I'm just sharing just a few researches, but there are so many different researches being done at this moment. So what is actually this behavioral science perspective that we are talking about? So in our institute, we followed the basic model of the person into environment and how the person interacts with the environment and has an outcome on the psychobehavioral um, what do you say, like some outcomes, something that we can understand. So whatever our behavior is not just an outcome of our personality, say, or the social environment, but an interaction of the person with the environment around them. So this can be seen better in Bronfenner's bioecological model. This theory is, I think, very fundamental to understanding anything about human behavior. So Bronfenbrenner talked about understanding a child in terms of this bioecological systems. So if you want to understand the individual, you want to understand his microsystems like family, peer, school, health services, and so on, and the mesosystem that these all different systems make. The exosystems is the mass media or the community around us, and the macro system are the attitudes and ideologies of the culture. So all these interact with the individual, and the outcome is the behavior. So for example, we have a classic example of knowing that in America many people don't want to wear a mask. So why? What is it that they don't want to wear a mask? So this is not just a personal choice, but a personal choice that is influenced by their culture, by their community, and the people they are interacting with. So the most important thing is that when we are understanding the impact of COVID, we have to understand the multi-level impact. It is that the individual is also having an impact on the environment around him. However, the environment is also impacting the individual's behavior. So as psychologists and behavioral scientists, we cannot forget that. And this reciprocal interaction must be taken into account if we want to change something, or if we want to bring about a positive change for understanding the impact of COVID. So I go on to another topic, which is about what is well-being. What is the well-being that I'm talking about today? So from my perspective and my research, I think it's very interesting that well-being is a in the world, key term in the World Health Organization's definition of health. So WHO has been there for a long time, and as early as 1948, and the latest definition I checked was 2019, they still define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or any infirmity. So I think from the Asian culture, I think spiritual well-being is deeply embedded in our overall well-being. So whether it's religion or it's culture or it's like an appreciation of the environment around us, this kind of spiritual well-being, which is not just about religion, but it's like a overall, belief in the purpose of life and something like that, that is embedded into our well-being. So I will go on. So what is well-being from the lens of behavioral science and psychology? So I'm just trying to, talk about that from behavioral science perspective. We talked about the model of Bronfenbrenner. So we can also call it the biopsychosocial model. And we can it has been used in understanding health also. So it considers the physiological, the psychological, and the social factors that are involved or impact your health and illnesses, and the interaction between these factors. These are multi-level, as we have talked about, and they have a reciprocal effect. For example, a family's well-being has an impact on the individual well-being, and the individual well-being has an impact on the family itself. So from the point of view of psychology, it's very, very interesting that psychology has no common definition of well-being, but the kind of definitions that are there, they are multifaceted. So they are talking about well-being in different dimensions, and they also use a multidisciplinary understanding. So I would like to share from the lens of psychology just two, different ways of looking at well-being. One is hedonic well-being, or the classic example is about subjective well-being of Diner. Diana talked about, affective and cognitive well-being, that when we are looking at the well-being, we must take into aspects, two dimensions or two facets. One is affect, the positive or the negative effect, and the second is cognition or the cognitive aspect. So as I think most of you are from psychology background, you would know that we have a positive effect, or say like a happiness, or negative effect is like distress. So these are positive and negative aspects. And cognitive is like what is my attitude, or what is my satisfaction towards overall life. So we have these affective and cognitive aspects explaining the hedonic well-being. On the other side, there is eudaimonic well-being, and a lot of psychologists have been working on that. But I think one of the classic examples of this that I would like to take is Riff's work on psychological well-being. And Riff talks about these 6 different dimensions about well-being: self-acceptance, positive relationships with others, autonomy, environmental mastery, purpose in life, and personal growth. So if we just like take a look back behind, we can see how different disciplines are contributing to this the concept of psychological well-being. We can see threads of clearly about psychology, like self-acceptance, but we can also see some interaction with other people. So this is like social psychology which is coming into process. We can see environmental mastery, so it's like psychosocial aspects which are there in us, and purpose in life. So this is something like a spiritual well-being that we would like to look at. So we have like a we can just conclude probably that psychology also is not just limiting itself to psychology. So like behavioral sciences, psychology is also embedding viewpoint from other disciplines. So from probably we can just conclude that well-being, when we look at well-being or we talk about well-being, we cannot differentiate it. We cannot just say that we are just taking a look at the well-being from one aspect. We are supposed to consider how well-being is impacted by other dimensions of our experiences. So, what were the psychosocial influences on well-being during COVID? I think because we are from psychology background, we understand that psychological variables have an impact on various outcomes. But specifically during COVID-19, what does the research show? So, as early as March, the APA, the Association of Psychological Association, they mentioned that psychological and social well-being are affected significantly by stay-at-home orders, social distancing, and other safety precautions needed to contain the pandemic that preclude social relationships. So, as early as March, we have started documenting this. Later on, like other researchers in June, Otto et al., they mentioned that psychosocial well-being is deeply affected, and it is having a different impact at individuals and community levels. So already the interactions have stopped. We have stopped, we are not able to meet our families or our friends. So it was already having an impact on individuals, but also on communities. So individuals, families, communities, and so on. The WHO then later on, it gave guidelines or a guidance on mental health and psychosocial considerations during the COVID-19 pandemic. So I'm just picking out some key things from that guidance which was mentioned. Then the WHO mentioned that we need to focus on the mental health and psychosocial aspects, especially for healthcare workers. I think all of us know that the frontline workers have played such an important part, but it has had a heavy toll on their mental health, and it's still going on. I think, unfortunately, in so many countries, it's still going on. It has an impact on the general population because I think none of us are living the way we used to do before. So our new normal has been defined, and especially people in isolation. So there are some people who are still subject to isolation, so that has a deeper impact. And people with comorbidities, for example, the elderly having some problems like diabetes or something like that, or even the young children having some health issues, they have had a more impact. So what else does the research show? There's another recent research that I would just like to show, and they are talking about that these impacts on mental health and social psychosocial well-being, these are not same. There are definitely inequalities which are there in our societies, which are there across different countries. Each country has inequality or a system which has come forward. Unfortunately, COVID is now pushing all these inequalities into the foreface. So we can all see that different people living across different countries are experiencing different impact of these inequalities during COVID times. And the COVID pandemic is definitely different from what we have experienced previously. The previous disasters like earthquakes or maybe even, like the swine flu or the H1N1 or something else, they were like limited. But COVID has impacted all of us all across the countries. So it's very, very different from any